Get some of that. All right. So hi, I'm Dr. Nikita Vizniak with the amazing
Ivona. Hi.
And Ivona's got an interesting case that she's going to walk us through right here. So it's an interesting case because it did result in some nerve injury to your neck and into your arms as well. And I just want you to talk about what happened during the initial injury.
Well, I really had an unfortunate accident where I fell down 13 stairs, broke up part of my L3, condensed disc in between L5 and S1, ended up having really bad protrusion.
Yeah, disc bulges and things like this. Yeah.
C5 and 6, had a surgery. This is my beautiful scar.
Yeah,
Doctor
fantastic.
has done an amazing job.
Really good job, actually, for sure. Okay.
But the, when you go into a surgery, they tell you that after 3 months, you should be good to go. I'm not quite there yet.
Not quite there yet.
6 years later.
Yeah. So, but there's a couple of interesting things here. First of all, the baseline of the injury that you had. So you fell down 13 stairs. What were the symptoms you had right to begin with?
First symptoms were a lot of pain in my lower back, mid back, my legs, because I actually hurt my muscles on my legs. I still have kind of imprints of stairs on it.
And that's huge. It actually tells you how much force there was. You have the imprints of the stairs on your skin. Yeah.
Still to this day. It was a lot of pressure, a lot of sharp pain. I actually drove from thinking after I gathered myself that I'm able to go to see my doctor. I had to stop from Burnaby to False Creek. I had to stop 5 times to even out my back.
Okay, so you had to stop 5 times. You were driving yourself, and then what happened? The follow-up was X-rays, MRIs,
X-rays. I went to work. It was positive.
Okay, but that's a huge thing to get right there. A lot of people, when they have injuries, they just shut down right away, but you still had the desire. You wanted to overcome this injury.
It was just not an option not to go, right? So after I went, my manager saw me and just said, it's just not okay. I need to go see a doctor to emergency. One of my colleagues drove me, did an X-ray, CT. My neck problem wasn't starting then, it started after the fact. So they've just put me on rest, and they couldn't put me in a cast because transverse bone you can't really do, it has to grow together. That's what they've told me. A lot of painkillers, a lot of resting. At that point, I wasn't able to do any kind of recovery or any kind of therapy.
Yeah, totally. So the key thing for me when you first came in was you weren't really enjoying your quality of life. Like you couldn't bike. You were told not to bike ride.
No contact sports, no any kind of big crowds. That was after my surgery. The initial problem of my neck started about 2 years after actual injury.
But the interesting thing for me was how you described the symptoms in your arm. Use the wording that you said for me, because it was
surreal. I could not feel, my hand wouldn't function. It was completely dried out. All of these muscles were indented. So if you see this was non-existent. All of this was completely hollow.
So if we look at it, what you would actually see is atrophy of the tissue. So I love how she described it, because she called it as dried out. It's whatever word whatever word the patient's going to use. It's great. But you would see atrophy all along here, atrophy in your triceps, shoulder pain, neck pain, everything.
Neck pain, head. I feel like to this day that somebody's pulling my head down and feel so much pressure that I have surreal headaches. So after the surgery, it was the major pain relief, but the residue of pain continued staying there. And of course, you're scared to do anything. You're scared to, well, after what they tell you, you can't do this, you can't do that.
Yeah, but just let's be clear. Who's told you what? Like, who says you can't do this? You can't do that?
Well, I mean, my doctors told me that after this kind of surgery, like I'm at risk of, like, if I really hurt myself or my head, that I'll be, well, they said the problem wouldn't be what they've actually operated on. It's the discs below and above that would burst in case of any kind of traumatic injury.
Mhm.
So for the longest time after surgery, I couldn't drive. You were not allowed to. I mean, they've told me, which was pretty, pretty funny. They've told me that I need to be super careful for first 3 weeks because my hardware might reject.
Yeah. So that's legit. That's legit because you can have an immune response to it for sure.
Well, hardware,
Yeah. Yeah, exactly. But so a couple of key things. So you've had a lot of, I don't want to say counseling, but advice that says you should be really fearful of this injury that you have.
Well,
right?
fearful for the period of time while all of this healed, and the healing didn't take part as it should. It was a little bit more, a lot more stressful than what I expected. I thought, being a workaholic, being taken off work 3 months after surgery, I'll be back to myself. But
and again, I just want to stress this throughout this entire case with you, which is great for anybody watching this. You always have a positive mindset and attitude towards getting back to doing what you like to do and want to do.
Majority of time, yeah. I do want to get back to my life. I loved my life. I loved my job. I traveled a lot. It was enjoyment altogether. I miss my colleagues. I miss being a functioning human. But 95% of the time I keep positive that I'm gonna get there.
Yeah, exactly. And we all know that there's ups and downs through all this.
Always.
So when you came in, we initially went through and did a range of motion assessment, checked reflexes, checked motor function and everything like that. What were some of the big outcomes that you observed from our interactions?
Well, I was for a period of time with a therapist, and he was great in the beginning, really paid attention to my injury, but it almost felt at that point that I was a number, in and out, not a lot of paying attention to detail, not a lot of interest to find out alternative ways to cure my or help my situation, right? So when we started, actually one super awesome girl that I know recommended Nick. So when I came in, my first impression was, okay, so this guy wants to know what I'm going through. And then when I was talking about the pain and difficulties I'm facing, I wasn't dismissed. I wasn't put to a case of, I don't know what I'm talking about. I listen to my body, I'm in tune with my body. And he actually provided different ways of how I could maybe find myself in a better living situation. And my pain is there every day, but doesn't mean that I can't push through. Some days, for 3 days, I'm in bed and I can't really, that's it. But on days when I have somewhat manageable pain, I push through with different activities and different treatments.
Absolutely. And so there's a couple of key things that came out of this. One of the big outcomes for me, and the reason that I want to bring this case up for everyone, was when I said to you, go and ride your bike. And you were so fearful of that, you hadn't ridden your bike in however many years. How many years was it?
About a bit over 5 years I haven't ridden my bike, and I love it.
Yeah. And you sent me that picture with you and your dog on the seawall riding that bike. And it's like a baby step towards the healing solutions that you're looking for,
it
right?
seems, for a normal person, it seems like a baby step. For me, it was a milestone, because for 5 years I was deprived of this like super joyful thing that I've loved since I was a kid. So for me, having a seawall ride on a bike was,
it's a big deal. Yeah, totally. Nice. All right. So there's a couple of other things here to go over. The next thing was you even came out and have tried some yoga classes and other things like that as well. Now let's describe how those went, because I remember teaching those classes and how that went for you.
So I'm a super hyperactive person. Yoga is boring for me. I've tried it before. I was like, is it gonna start going? So Nick has convinced me to come and actually join his yoga classes. They're not typical yoga classes. I'm pretty sure everybody could agree with me. They were fun and interactive and kept my interest going. So that has really helped me move a little bit smoother. So in the mornings when I wake up, it's not, well, Nick wanted me to come here at 9:30, but you know, mornings I need an hour to be able to do my stretches, my yoga poses, have a coffee to be a nice human being.
Yeah. This doesn't just happen automatically.
No.
Oh, all right. Yeah. All right. So we've got that right there. But what I can remember from a few of the yoga classes, and my hat's off to you for doing it, is you could tell how you went to your limit and then you stopped for a little bit and you modified your positions, your poses and stuff when the pain got too much in your shoulder or something, or you had to change it.
Yeah.
But the fact that you came out and tried, that was the big win right there, right?
Yeah. I mean, a lot of us are ignorant in a sense where I don't like it, I'm not going to do it. I'm in a position where I can't really afford to be ignorant. I'm in a lot of pain. So if I can try it, I will try it. It might not work like other treatments. It might actually really help me out. So I can't leave it to a chance. I have to see, and then decide what my options are.
It's even better than that. It's do, see, and experience to see where you are on that day in your own body. Why don't we talk about your pain? What have you been doing for your pain management? Because that's a long story too, right?
It's, well, it first took, after my surgery, I actually took myself off strong med 6 day, which my doctor said I am insane. A lot of people end up being on really strong drugs for a very long time. I couldn't, they were making me sick. I was vomiting. I was in a lot more pain when I took them because they made me feel, there's just no explanation for it, right? My body reacts to chemicals really hard. So I get sick easily, and it took 2 years for my doctors to find out kind of perfect mix of medications that would not make me sick, but somewhat lower down the pain so I can function on a daily basis.
Yeah, and this is a pretty common thing for us to talk about too. You'll see a lot of people, especially I find this for female patients who are more in tune with their body and more sensitive. Any lower levels of medication can often have larger effects because they have lower body mass. So you have to be looking at lower dosing typically, right?
Lower dosing and a lot of mind-altering drugs they prescribe these days. First, they're highly addictive. Second, I don't feel myself. I would rather have one level of pain to go through my day with than not be mentally myself.
Yeah, totally.
Or it would make me feel very lazy, not motivated. So I would end up spending my day on a couch, which is sometimes okay, but it's not okay on a daily basis for me. Right?
Yeah, totally.
So I do a lot of stuff. First and foremost, I do eat quite healthy, so my body is eliminating inflammations from inside.
Nice, right?
And that's one of the key things.
Yeah. How did you find the right diet?
Nutritionist, reading a bunch of different things, picking up from my friends that are living a healthy lifestyle, just everything pretty much. You got to resource your information from all sides.
Yeah, exactly. And then find what works for you.
What works best for me.
Okay.
I mean, I have a cheat day. I love pizza. I'm not going to hide it, but you know, majority of time it's what makes you inflame from inside that can cause a lot of problems.
Totally.
Right?
And so the big thing here is exactly that. People think, oh, I have a cheat day. No, you need to have a cheat day. You cannot be solid diet 24/7, 365. You will not enjoy your life if you're doing that.
Yeah,
right? So
it's not life.
Yeah.
I love food.
Yeah, exactly. All right. So then another thing was, what have you changed as well? Because as we're going through, number one, getting you moving a little bit more, getting you riding your bike, coming out to some yoga classes, then you started lifting and becoming more physically active as well.
Well, then it was point kind of like I go for walks. I have a dog. I go for walks every day. So that was one of the main, because with this kind of injury, you can't really exercise as every normal human being. It takes a lot longer to achieve anything. So for me, I was putting the little steps, literally baby steps every day, walking with my dog, stretching, yoga. And then once I got an okay to ride my bike, well, I thought maybe it's okay to actually up my exercise levels. And when I say up, that doesn't mean that I'm going to be lifting huge amounts or whatever it is, but persistent, small, tiny baby steps.
Exactly. Perfect. And that's what you were doing. You could see, so as one of her healthcare providers, I could see the change in her overall. I think you could even, because, you know, I'm working on her back, working on her neck, things like this, you could actually see the increase in muscle definition and strength and your own happiness with it too. Like the things were correlated together.
Yeah,
right?
exactly. I mean, I hate the gym. I'm
Okay.
not a human that's like, oh, I'm gonna wake up, have my coffee and go to the gym out of enjoyment. I do it because I have to function. And if I don't do it, I don't operate in a normal life. And it's not like I can operate like a normal human being or whatever. I still cannot work. I still need help with cleanup of my house. I can't, you know, I empty dishes. I have to bend down each time, not bend down, but like squat down, control all of my movements. But you learn how to live with it, and that's life, and you just accept it, I guess.
But you're finding functional outcomes out of this, is what you're getting.
Well, yeah, I mean, I fail and I cry and I'm depressed for days, but then it's really in our hands what we do with it. I mean, it's okay to be down for a few days, but then you gotta pick yourself up and continue moving. But moving has been a huge part of my recovery.
Yeah, totally. Right.
Yeah.
And I mean, that's what we're here to do. We're all here to support and help you meet those requirements.
Yeah.
So you're trying to find a good healthcare team that can help facilitate that for you, right?
And
so,
I am fortunate enough in last 2.5 years,
three years, yeah.
I've had numerous different doctors, Nick including. I have a trainer. I actually have great support at the pain clinic at Jim Pattison Outpatient Center. Doctor is amazing there. He does lots of trigger point injections for me. He does nerve blocks in my lower back, electric shocks to try and manipulate my spinal cord to forget the pain that I'm experiencing every day.
Looking for some pain
it's a process,
modulation.
exactly. But he actually had a point not too long ago. I came and I said I was still in pain. And he said, well, we're here as your doctors to support you, find a way how to live with this pain. We're not, unfortunately, you won't be able to get cured, which I'm well aware. It's not the first time that any doctor said that to me, but finding a way to live with it is a huge step, but you gotta have the right team to support it.
Yeah, huge. All right. So just so everybody can see, I want to just flip over. We're going to go into see her MRI right now really quick. So we can so if you're looking at the screen right now, you can go ahead and see this is Ivona's neck right here. It is fantastic. So you can see wonderful layout as we go through the MRI here. I mean, if we come right to the lateral side, you can see her SCM, muscles of the neck, upper part of the lungs right here, back muscles. And you can even see her cerebellum, jaws all up here. So for orientation. And as we progress through, there you can see her zygapophyseal facet joints. And as you progress in, you get into the area of the vertebral bodies, and you can see this area of blackness right here. That blackness means no tissue density. There is no fluid in there. This is dead tissue inside right there. So we've got 1, 2, 3 segments that have been sandwiched together. And that's where she would have gotten her symptoms down her arm, where it felt dried out and everything like that. But what happens for people is they focus on these MRI findings and they think, well, nothing's going to change. This is the way that it is. The body does heal. It is incredibly resilient. Now, what I want to do is just fade back to this. Because even our treatments haven't all been roses and, pretty smelling flowers and all this kind of stuff. Like some of the things can be a little bit more aggressive, right?
Yeah, I mean, I don't really know what a fluffy massage is. I used to know what it is. For me, these days, massages are quite painful. Shout out to Brad as well, who's part of my team. He's been my massage therapist for years. I come to Nick. He'll adjust me. He'll use weird tools.
Okay. But you get benefit from it, right? Like
absolutely.
That's why you come back.
Well, I can't really function because it's mostly managed in between Nick and Brad, where they make me function on a daily basis. That's the bottom line. If I don't see them, my back is definitely telling me when is the time to see them, and it knows by calendar almost.
Yeah, right. Yeah, exactly.
Yeah, it's a routine that I cannot miss. So
yeah, and it's even part of your routine, like you're saying, drinking coffee, doing some stretching and activation and movement stuff.
It's
Like it's
just
all part of it, right?
part of it. Yeah,
Yeah.
absolutely. And I think a lot of people that I think I can speak for myself and quite a few people with chronic pain that it's just really important not to give up, because it's really you. He can say whatever he thinks.
Yeah.
My other doctor can say whatever he thinks, but it's really you who needs to put work to be able to.
And that's the big win.
All of it.
That's exactly it. And that's the big win, is we're here to facilitate, but ultimately you have to make the choices and decisions to actually
It really,
make the
if you
change.
don't help yourself, nobody else will.
Yeah.
If you ask me.
We try and do our best. We're trying to support, but yeah.
Yeah.
All right, Ivona, I just want to thank you so much for doing this. Is there anything else that you'd like to add that we haven't talked about?
No, nothing else. He might torture you. Apparently I have a high pain tolerance, but it does help in the long run. Therapists are, honestly, every time I walk out of any doctor or therapist, I say that thank the universe they exist. And I'm grateful that I can walk today, because I would have been on the other side.
Yeah. And you can see that from the initial injury right there. Exactly. So I just want to say thank you again so much for doing this. And it's been great to have you.
Thank you.
All right. Good stuff. Yeah, that's basically it right there. There's nothing else you want to add? Yeah.
No.
Okay. No, you can just talk normal. Like we can still talk for a little bit. Maybe I'll put some of it in. I was going to bring up how you don't like upper cervical adjusting, like, because this will be a lot of chiro students will want to see this.
Yeah.
So that.
So I was told once the parts have been inserted in my body that I'm not allowed to do cervical adjusting. And I'm super scared to do it.
Yeah, totally.
It gives me like really uneasy gut feel. These days I listen to my gut.
Yeah, totally. But even having said that, we've actually done a few upper cervical adjustments, but the outcomes, it didn't result in anything better. Now, I'm very specific with my movements, extremely upper cervical, away from the areas of hardware, just to be clear on that. But you could see your reaction to it was not the most positive, right? Like you could see you almost got a little bit of a headache from it, and it was just kind of a reactive rebound headache. So it tells me that this is not the right treatment at this time for you.
Yeah, absolutely. Right? I mean, it's important that you're working in tune. You know, if I'm listening to my body, my therapist listens to it as well. And it's there's a lot of therapists that don't really pay attention to that kind of stuff. But I think it's one of the key things in a client patient doctor relationship, where you need to understand the patient.
Totally. So this is exactly what I write on all the time. You see it in all the books, having that, therapeutic alliance with your patient. She realizes that just from her own verbiage and words as she goes through there. But when we were trying the upper cervical mobilizations, we were just trying other things to see how you would respond to it, right? It's always a matter of practice and small little challenges to see what works. Nope, that was too much. We're going to back out of this and we'll try a different way. Yeah. So that's the main thing to focus on.
Absolutely.
All right. So again,
teamwork.
Teamwork makes the dream work, right?
Yes.
All right. So I just want to say thanks again for Ivona for doing this, and hope you enjoyed this, and we'll thank you very much for your time. If you need further information, you can find it on our website or any of our textbooks that we've written, and hope you have a wonderful day. Thanks.
Ta-da!
Okay. All right. Good.